So CoolSculpting utilizes cryolipolysis, which is the freezing of fat cells to gently and effectively remove fat permanently. So important to acknowledge that it is permanent fat removal. So during treatment, you're going to come in, I'm going to place your applicators. We're going to freeze those areas of volume that you are not happy about. About 2 to 3 days post-treatment, those fat cells are going to start to dislodge and shrivel that we have frozen. Essentially, what happens is, over a 12-week window, they are permanently eliminated through your waste. So your body naturally rids itself of these fat cells for good. One of the many things I love about CoolSculpting is that they have even followed up on patients 9, 10, 11 years after their initial treatment, and the results still stand, even with a little bit of body fluctuation. So when we work out, we shrink those fat cells. When we CoolSculpt, we eliminate them for good. So what areas can we treat with CoolSculpting? We can treat under the chin, arms, back fat, love handles or flanks, abdominal area, inner thigh, outer thigh, banana roll, which is underneath the buttocks, or the distal thigh, which is above the knee. All of these areas, again, are FDA approved for clearance for CoolSculpting, and generally you're going to have 2 treatments spaced a month apart, and those results are going to come in beautifully. I like to say that 80% of my job is choosing the right CoolSculpting patient. It's very important that your provider is a graduate of CoolSculpt University. I'm a double graduate of CoolSculpt University. I've also taken extended education classes because when you know better, you do better. It's really important that I get to feel those areas. Be sure that what I'm feeling is subcutaneous volume that you want to get rid of. Subcutaneous volume is volume or fat that's on top of the muscle, that's pinchable. If I can squeeze it, I can freeze it. That is what makes a great candidate for CoolSculpting. Let's talk about who isn't a candidate for CoolSculpting. Visceral fat, which is that hard volume. If you think of like a rounded, almost like a turtle shell, like a rounded, hard abdominal area that is non-pinchable, we can't treat that. The applicators are suction driven, so if we can't draw that volume into the applicator, you're not going to get results. If it's someone that is mostly skin, CoolSculpting isn't going to be able, we're going to draw all that skin in and we're never going to reach the volume. So that is why it's imperative that you have a well-versed and educated provider like myself, and that you come in for that CoolSculpting consultation. Let me see those areas of concern. I want to be sure that it is subcutaneous. I want to look at your skin to volume ratio. I want to be sure that you're going to get the absolute best results possible. So if you have that hard volume, if you're mostly skin, if you have cardiac implants, pacemakers, things of that nature, that would sort of disqualify you as a CoolSculpting patient. But for that subcutaneous pinchable volume, again, if I can squeeze it, I can freeze it. So the magical question is, how many treatments do I need? Well, let's talk about that. It is not a cookie cutter treatment. I like to customize plans based on my actual patient's body frame and how that volume or tissue is allocated. So when you come in, we're going to look at those areas of concern together. And again, I will provide you with a treatment plan in writing of exactly what we're doing, how many treatments are needed. You definitely are going to have at least 2. Treatments are spaced 1 month apart. So you would come in for your treatment and a month later, retreat those same areas. You get a 20 to 25% reduction per treatment. So it does take 2, sometimes 3 or 4. You really can't decide that until we sit down together and look at those areas of concern, because I had a patient that was my same height and weight and our plans were completely different. So it's really important that I get to see you in person, and we want to be sure that I'm feeling those areas and making sure that this treatment plan that we're coming up with is going to give you the best results possible. And I guarantee they will. Downtime. Let's talk about downtime. CoolSculpting offers very little to no downtime post-treatment. Your areas are going to have some tenderness. They're going to have some numbness. Sometimes patients will get a little itching where those kind of nerves sort of wake back up. And if we're treating the abdominal area, you'll get a little swelling. That's for a 2-week window. You can get on with your regularly scheduled program. Your only homework with CoolSculpting is to avoid anti-inflammatories, Advil, Aleve, for 30 days post-treatment. So we just recommend stick with Tylenol for 30 days if you get a headache, if you're uncomfortable. By taking anti-inflammatories, it's going to delay your results. We want those results to come in as quickly as possible. I want you happy. I want you thriving and confident. So really, very little to no downtime, soreness, some numbness, tenderness to touch, and a little bit of swelling. All of that, you can still, again, continue with your regularly scheduled program. One of the many perks of CoolSculpting, getting on with your life. Coming in today, Amy. I'm Cherylyn, the Master CoolSculpting Specialist here at the Swan Center. I understand that you're interested in CoolSculpting some areas of concern that you have.
I am.
Well, talk to me. What are those areas of concern?
Well, I go to the gym regularly. I have a fairly clean diet. I just have a couple of trouble spots that don't seem to budge. And my biggest area of concern is my lower abdominal section.
All right, Amy, so I know that your primary concern is your lower abdomen.
Yes.
And what I want to say that's so important that patients really do need to come in for a consultation is that while you have a little bit of elasticity loss here, you also have pinchable volume. Mm-hmm. So when we're treating the lower abdominal area, we want to treat the entire area. So the little area at the top, it's very important. If we flatten the lower abdomen, you're going to have a little bit of a shelf-like area at the top. So it's very important we treat the entire abdomen.
Great.
So you are a candidate here. It is pinchable volume. Is this something that you wanted to move forward with today?
Absolutely.
Awesome. We're going to take care of it. Thank you so much for attending our virtual CoolSculpting event. I hope that you feel so educated and so pumped about having treatment. I want you to be sure to check your text when we have completed the Q&A, because I want you to respond back as quickly as possible so that we can get you in for your consultation. The Q&A is about to begin. I want you to submit your questions through the question box. It is anonymous. I'm going to answer those live. I want you educated and ready to go. And then just another reminder that we will notify you by email if you have won any of the prizes at hand. Again, thank you so much for attending. I cannot wait to treat you. Let's do it. I'll see you soon. Hey everybody, thank you so much for attending our Cool event tonight. I'm Cherylyn, the Master Cool Sculpting Specialist here at the Swan Center. Super excited to answer all of your questions. I see here we have, does it hurt or feel freezing cold? The first 5 to 8 minutes of your treatment period feels just like in the wintertime when your hands are really, really cold and you place them under hot water. It's that type of spicy sensation. So again, it's really cold outside, your hands are really cold, you put them under that hot, warm water, feels a little spicy. You're going to feel that for about 5 to 8 minutes. That is the technology bringing those fat cells that we're getting rid of down to that cooling temperature. At the end of your treatment area or areas, I'm going to remove the gel pad and the applicator and do a 2-minute massage to sort of wake that area and break that area up in the sense of it's frozen. We want to bring it back to temperature and kind of break up and wake up those fat cells that we've frozen. You'll feel that same sensation for about a minute or two. Other than that, it's just numb, a little tender, and if it's the abdominal area, a little swollen for about 2 weeks. So you really just feel that spicy feeling, 5 to 8 in the beginning, 1 to 2 in the end. Let's see what else we have here. Does the chin area require 1 or 2 treatments? Depending on how the tissue is allocated. It can require 2, meaning 1 a month later, the second treatment. Or if you have volume along the jawline, I'll double them up and do 1, 2, a month later, 3, 4. As I stated in the event, it isn't a cookie cutter procedure. So someone may come in and really just have that submental volume in the center, or you may have that volume all the way through where we have to double up. So the answer to that is that it could be 2, it could be 4. We would just want to take a peek and see. Consultations are complimentary, so it doesn't cost you a thing to come in and get looked at, figure out what your quote is going to be. With this particular event, we are offering our applicators at $6.50 each. You buy 4, you get 4 free. On top of that, if you're interested, you can also get a free area of Botox included. So $6.50 per applicator, buy 4, get 4 free. What does that mean? Say we're doing your arms, 1, 2, a month later is that second treatment, 3, 4. And then if you have another area, you treat it for free. So all we're going to have you do is come in for your consultation, offer you that awesome pricing, and write it up for you to figure out what's going to work best for you and the way the tissue is allocated on your body. If you're interested in a consultation to reserve the event special, please, please, please select yes on the vote that is popping up on your screen now so that we can reach out to you, because we want to be sure that we get in touch with you so you can take advantage of these awesome prices. Let's see what other questions we have here. Do you lose weight with CoolSculpting? CoolSculpting is about inches. Generally, it's not a weight loss tool per se. With CoolSculpting, you want to be within, say, 20 pounds of what your healthy goal weight would be. 20 to 30, it all depends on how the tissue is allocated on your body. I know I keep repeating that, but again, I want to be sure that when I treat you, I customize that plan so that you're going to get the best results possible. So no weight loss, definitely inches. What else do we have here? Is there any bruising or permanent bruising? No, we do not have permanent bruising with CoolSculpting. When the technology first came onto the market in 2010, the applicators were deeper, so it sort of compressed the tissue and you had quite a bit of bruising. That was 14 years ago. We have the latest version of the technology, which is CoolSculpting Elite. CoolSculpting Elite is less than 2% bruising. I can't tell you. Maybe one patient, maybe if you're taking like a blood thinner or a preventative aspirin, you might be more inclined to bruise, but generally, no bruising with CoolSculpting Elite. Let's see what else we have here. How long do the results last? Awesome question. It's permanent. So the way that CoolSculpting works is we go in, we freeze those fat cells or volume that you're not interested in. Over a 12-week window, those fat cells kind of shrivel and they are permanently eliminated through your waste. So you get a 20 to 25% reduction per treatment. It takes two. So you're going to be looking at least a 50% reduction in your area that you're not really fond of. So what we're going to do is go in, we're going to do that first treatment. If you kind of compare it to when you're a kid and you're riding a bike, you fall off your bike and you skin your knee. We're taking that first level off, and a month later, we're going to go in and get that second level of volume to really kind of snatch that area in and give you the curves that you're looking for. Let's see, how many areas can be treated at once? Well, that is an awesome question. Arms, I can treat them at the same time. Abdomen, flanks, bra roll, they can be treated at the same time because the tissue is far enough apart that it's not going to pull. If you wanted arms and abdomen, I can treat those at the same time. It really just depends on, how the tissue is allocated on your body, which areas you want. But generally 4 areas at once, or say 4 arms, 2 areas on tummy. We write it all up for you at your consultation so that it's a drawing and it's written. So you're able to visually see it, but also numerically see it. What else do we have here? What is the average cost of first treatment? Well, that's a great question. It's not something that I can tell you right off the bat because what areas are we treating? How many areas are we treating? That is why we offer that complimentary consultation so that you get all of your answers at once and it's in writing for you to take home. I can tell you that we're offering our applicators $650 each with this event, and you buy 4, get 4 free. So you're looking, if you treated 2 areas twice, you're looking at $2,600 for that first area, and then that second area would be complimentary. So that's pretty awesome. Let's see here. What else do we have? Are there any restrictions following my session, like flying or working out? Not a bit. The only restrictions with CoolSculpting are to stay away from anti-inflammatories for 30 days after each visit. So just sticking with Tylenol. If you get a headache, if the area is tender, stick with Tylenol. With anti-inflammatories, the reason we ask you to sort of avoid that for 30 days is that it won't keep your results from coming in, but it will delay them. So we want you to lay off any anti-inflammatories for 30 days just so we get those results in as quickly as possible. Let's see what else we have. And again, you can fly, you can work out, you can do all the things. There's not really an interruption to your regularly scheduled program. I had CoolSculpting many years ago and the applicators were very large and bulky. In addition, it was quite painful. Has the equipment improved from the earlier years? Absolutely, it has. I like to call that first round of technology the legacy applicators. And what a legacy they left. So, did a wonderful job, but they compressed that tissue. And when that happened, it caused so much bruising and so much swelling. You still get a little bit of swelling on the abdominal area with CoolSculpting Elite, but nothing like the legacy applicators. That was the first round of technology in 2010. In 2016, when you know better, you do better. They designed what they called the Advantage applicators, and they were a little wider of a mouth. The applicator was shaped a little differently, and they went a degree colder. So it helped the time of your treatment to be less, but with the same great results. Spring forward to the technology we have now, which is CoolSculpting Elite. You have a much larger treatment area. The applicators are larger. They are ergonomically designed to feather out that result so that you're not looking at like, okay, I placed this on my arm, I'm going to have from here to here. Inside, that cooling is going to feather out so that when your results come in, it's a very natural curve. Let's see. Is it painful? The first 5 to 8 minutes of treatment aren't painful. What they feel like is in the wintertime when your hands are really, really cold, or your feet, and you place them in hot water. So you wash your hands, you jump in the shower. You know that kind of spicy feeling? You'll feel that for about 5 to 8 minutes at the beginning of your treatment. That is the sensation of those fat cells getting into that freezing mode. We gently bring that temperature down. Your skin is protected from overexposure to cold with a gel pad, so and it does its job beautifully, so you have no worries there. And at the end of treatment, when I remove that gel pad and that applicator, I do a 2-minute massage to kind of wake it up and break it up. You'll feel that spicy sensation for about a minute or two. It is nothing like the very first round of the legacy applicator. So when you know better, you do better. And they listen to us, and they have really made it quicker, efficient, and much more comfortable for the patient. Let's see what else we have. Do I need to be at my ideal body weight to start? We would like you to be within, say, 20 to 25 pounds of your healthy weight, and each person is different. So I'll look at that and take that into consideration when I see you. I have 2 types of patients. I have patients that they've done the work, they've met their goal weight, and they sort of reward themselves with CoolSculpting. And then I have my patients that they're beginning their journey, and they kind of want that little kickoff to help them. Whether that fat cell is this big or this small, we're killing it. We don't have to worry about what size it is. We're going to go in there, we're going to knock it out, and it's going to permanently be eliminated. What else do we have here? If I have fibroids, are you able to receive treatment? What I would like for you to do is to get a clearance from your treating physician that, that they're okay with it. I am not able to make that decision, so I would prefer that your treating physician let you know if they are comfortable with you having treatment. I would not want to cause you to have any discomfort that's not necessary, so we would let your treating physician make that decision. Let's see here. By the way, before we move forward, as a reminder, you will receive a text message, and it's really important that you reply with the code word SWAN so that we can contact you for a consultation. So you're going to receive a text message when we're done. Reply with just the word SWAN so that we can reach out to you in the next day or so and get you in, okay? I didn't want to forget that. Let's see what else we have here. I mostly have fat in my abdominal area and I have breast implants that I want reduced. Can I get both done at the same time? If you are looking to CoolSculpt your abdominal area, the volume there, you can certainly have your CoolSculpting done. We will not do that during a surgical procedure, but we can certainly do them in conjunction, meaning I can do your CoolSculpting, and then if you choose to come in and have your breast implants reduced or a change in your breast, you can do that, and we can work around your recovery and implement your second CoolSculpting treatment. But they would not be done at the same time in the OR because you wouldn't, A, want to pay for the extra time to be under. And with CoolSculpting, one of the greatest things about this technology is you can just get on with your regularly scheduled program. So say you do your treatment, then you have your surgery and you recover, and our physician says, yeah, it's time. You can certainly be released for that second treatment. You can have that done while you're still under your recovery period, or you can wait until you're ready to get back at it and get back in the gym and do that second treatment. And I love that you have the option to sort of figure that out and customize what works best for you. Let's see here. Is this procedure ideal for individuals who have had extreme weight loss? Let's talk about that. That is an excellent question. If you have had extreme weight loss, and you still have some pockets of volume or fat that are bothering you, it all depends on how much skin you have. If you have a redundant amount of skin or tissue, we're going to pull all of that skin into the applicator because they're suction driven, and then we may not reach that area of volume that's really bothering you. So I would want to see you for that. Consultations are complimentary. I would want to look at your skin to volume ratio and figure out, is this patient going to get the results that I really want them to have and that they desire if we do CoolSculpting? If you're a better candidate for surgical intervention for skin removal, I will certainly be honest and tell you that. You can go to the surgeon of your choice. We have 3 surgeons here that are incredible in our JCO accredited surgery center. So you always have options. Let's see here. How long do the results last? Well, I have some great news for you. The results are permanent. Once those fat cells are frozen, they are permanently eliminated through your waste. It takes about 12 weeks to get those results. So we do your first treatment. A month later, we're going to do that second treatment. By about 2 weeks after that second treatment, which would be 4 weeks after your first one, you're going to start to see those results come to fruition. By 12 weeks, your results are completely in. What I love to tell my patients is your curves are my canvas. I want to look at you and I want you to leave here at that follow-up after these results have come in feeling your best. I want you confident. I want you to have absolutely no problem putting on whatever dress or bathing suit or tuxedo or whatever and feel 100% like you can just take on the world. That is what CoolSculpting is about. Your confidence, how you feel in your skin, your body. That's what it's all about. And that is why it's so important that you have someone that is a graduate of CoolSculpting University. I'm a double graduate. I'm a Master CoolSculpting Specialist. I take further education classes because I want to be the best so that I can be the best for you. What else do we have? Can more than one area be treated at the same time, like jaws and arms? Absolutely. I can treat your chin or your chin, depending on the applicators, and your arms at the same time. Or maybe we're doing chin and abdomen. Maybe it's arms and flanks. Yes, I can certainly treat 2 areas at once when they're allocated. The only area that it's a little iffy, and I have to look at you to see, is the abdomen. Because while it might be upper, mid, lower, with the abdominal area, it's very important that I cross those applicator treatment areas over for continuity. What we don't want is to put 2 on at the same time. You can't put them on top of each other, so you're going to have that speed bump of non-treatment. I have patients that have come to me where they've gone to certain places that maybe they were in a rush or maybe they didn't know, and they have that area of non-treatment. And I want you to leave here looking better, not feeling worse. We don't want areas that are not treated thoroughly and smooth. So other than abdomen and inner thighs, yes, I can treat them at the same time, like jaw, arm, flank, bra roll, outer thighs. Can you lay in the sun after the treatment? I would recommend waiting at least a day, but I would also recommend making sure that you're using sunscreen if you're in the sun, because we want those areas and all of our areas to be protected. But yes, you can. Give it at least 24 hours though. Let's see. I am African American, so I'm concerned about keloids. Is that a problem? We haven't had problems with keloiding with my patients that have experienced keloids. Like some patients are more prone to it if they get an injury, or maybe they've had a scar or a surgery of some kind and they're more prone to keloids. Because this is a non-invasive treatment, we have not had an issue with patients that are even prone to keloids having a problem with CoolSculpting, so no. How long does a session typically last? Well, that depends on how many areas we're treating. If we're just treating, say, arms, the actual treatment time would be 35 minutes, but you'd be with me about an hour to an hour and a half because I want to mark those areas. We want to take pre-treatment photos just so we have a visual baseline of where we started, because I have you come back 12 weeks after that last treatment. It's easy to feel your results, but because that 12-week window passes, it's hard for you to see them. So it's really great that you come back. I give you the same treatment shorts. We use the same backdrop, the same foot guide. I want apples to apples evidence of your awesome results. So I always like you to come back and get those photos taken, print them out for you so that you have, you feel like, wow, I can actually see. This was a great investment. I'm so glad that I did this. For the session lasting, That's going to be how many areas we treat. That's going to be if they are outer thighs, arms. So when you come in for your complimentary consultation, I'm going to put all of that in writing for you. Exactly what we're doing, what areas we're treating, how long your treatment time is, and certainly, of course, we'll put in writing as far as cost. For those that may have just joined, we are offering special pricing. It's $650 per applicator. Buy 4, you get 4 free. And for those that are interested, we want to offer you a free area of Botox as well. Let's see what else we have. Do you have to diet afterwards or before? Is there a long-time diet plan that you need to follow? Absolutely not. We want you to continue doing what you're doing post-treatment. If you're going to the gym 3 days a week and eating an 80-20 healthy diet pre-CoolSculpting, you continue with that regularly scheduled program. I will ask that you drink more water. What's really important, though, is that it's not a green light to stop doing those things. If you are that 3 day a weeker in the gym, or maybe you're 1 day a week, or maybe you're not a workout person at all, CoolSculpting, you can benefit from CoolSculpting. What we want to really drive home, though, is that you have to have continuity in what you're doing as far as your movement and your food intake. Your remaining fat cells can still expand and contract based on weight fluctuation. So you want to be responsible in how you're moving your body and what you're putting in your body. But you don't have to go on any type of diet plan. Let's see. Could you possibly have loose skin after the fat dissolves? That's a wonderful question. One of the things that I check during your consultation is your skin to volume ratio. If you are a patient that has a great deal of elasticity loss, and I feel like you're going to gain skin if we remove volume, I'm going to tell you that up front. That is not a surprise I want my patients to have. I want you to know up front, this is what to expect. We will not create loose skin. But if you already have established loose skin, then we're going to have that discussion, because I want you to know, and there are some people that have signed things that have said, I understand I'm going to get loose skin. I want this volume gone, and that's totally okay. But we'll discuss it prior to treatment. I want you to feel as confident as I do moving forward. Does CoolSculpting help reduce cellulite? Another great question. CoolSculpting is not a cellulite treatment. Having said that, it does offer a small amount of tightening, so it will not make it worse, but it's not going to improve it per se. How many years of experience do you have in CoolSculpting? I have been around since the beginning of CoolSculpting. CoolSculpting was FDA approved and placed on the market in 2010. I have been treating since that time. I went to CoolSculpt University for the first time and became an advanced certified CoolSculptor in 2014. I became a master CoolSculpting specialist in my second go around and continued to take educational classes. So 14 years and counting. And I'm also a CoolSculpting patient. So when I speak with you as a provider, I'm also speaking with you as a patient. That's why I can tell you exactly what to expect for sensations, when those results are going to come in. I had my flanks treated in 2012, and my results still stand because I've continued to kind of move my body and eat the same and just try and take care of myself the best that I can. So 14 years and counting, and I'm absolutely passionate about this technology. It is cutting edge. If you would have told us 15, 20 years ago in this industry, because I've been in aesthetics a long time, much longer than before I started CoolSculpting, that we would have a non-invasive treatment that could give results like this and permanently remove fat, I would have been like, okay, here we are. And Allergan, who is the manufacturer of CoolSculpting, continues to improve this technology. It's not a one and done. We already have, the latest and greatest version, which is the CoolSculpting Elite. And I have no doubt in my mind that there is somewhere in Allergan, they're a worldwide company, they're researching what we're going to do next to make it better. What else do we have here? How soon can you get back to normal routine? Immediately. You're going to come, you're going to have your treatment. You're going to have some numbness, some tenderness to touch. And if you're treating the abdominal area, you'll get a little bit of swelling, but you have no restrictions. You can get right back at it. If you want to take a walk, you can take a walk. If you work out, you can work out. Go to work, take a nap, have a glass of wine. There's not really any restrictions. Your only homework with CoolSculpting is to avoid anti-inflammatories for 30 days after each treatment. It's not that it's going to keep your results from coming to fruition. It's that it will delay your results. And we want those results as quick as possible because we want to feel great. We made this investment and we want to enjoy it. I have IBS. Is that a restriction? That is not a restriction. If you have concerns with that, you can certainly speak with your treating physician, but IBS, this wouldn't do anything that would cause your IBS to flare with CoolSculpting. How long must I refrain from alcohol after CoolSculpting? If you would like to have a drink after CoolSculpting, you are welcome to do so immediately. No one is going to be upset if you choose to do that. However, I do recommend that you up your water intake for at least a week or two post-treatment to begin that flushing process, because the way we get rid of these fat cells permanently is over a 12-week period. These fat cells kind of dislodge and shrivel, and they're permanently eliminated through your waste. The reason it takes 12 weeks is because we're not artificially pushing anything through your body. We are letting your body naturally process these fat cells and purge those out through your waste. So upping that water intake is important. I want you to stay hydrated. I want you to show up to treatment hydrated and with a little something on your stomach. I like to tell everybody, day of treatment, you have 3 responsibilities. Eat something, drink something, and figure out what you want to watch on Netflix. Other than that, I want you to come in and relax. I'm going to get your treatment started. I'm going to get you snuggled in with warm blankets, and we're going to have a good time. You're going to watch some Netflix and relax. Is there any situation CoolSculpting can't conquer? That is a great question. If you have a lot of loose skin, we are going to end up drawing all that loose skin in and never really get to the actual volume. So loose skin, if you have like really redundant tissue, would be more of a surgical intervention. If you have any type of like pacemaker, defibrillator, any type of electrical implant, we would not treat you, would not be a candidate for CoolSculpting because we not want to interrupt anything electronically and have any type of medical emergency. If you are overweight to maybe 30 pounds or more of what would be your ideal weight, I would want to see you. That is not, there is an exception to every rule. So I would want to see you. Again, consultations are complimentary. It all depends on how that tissue is allocated on your body. So I don't want to say no, but I would want to see you determine that, because I'm very honest and ethical in that if you're not going to be a great CoolSculpting candidate, it is your body, it is your time, and it is your money. And no one should tell you what to do with those things. And if I can't give you what I feel like we have decided you want, I'm not going to take your money, your time, or risk your body. I'm going to respect you and be honest with you up front. So CoolSculpting can't conquer everything, but I will certainly be honest about what it can and can't conquer. And I do that on an individual basis because everyone's body is different. Does it tighten the skin? CoolSculpting is not a skin tightener per se, but it does offer a small amount of tightening when you're in treatment. It's not, if you have like redundant tissue, or if you can grab the skin and pull it away from the area, CoolSculpting is probably not going to tighten to the degree that you would want that. It would be more like a micro needling with radio frequency type thing, but it will offer some tightening. What else do we have here? I do want to remind you, because I know we've had some more people come on, that we are offering a buy 4 applicator, get 4 free. We are offering them at $6.50 each. So you would pay for the 4 applicators, get the 4 free. We can allocate those on the body during your consultation however we see fit to give you the best results. With this special, you are also receiving a free area of Botox on the house here at the Swan Center from one of our master injectors. All of them are incredible. I really, really hope that when you come in, we get you scheduled, and you can certainly meet your injector that day briefly, just to say hey if you'd like. You can also go on our website, and it's swancenteratlanta.com, and look up our injectors if you want to do a little research in advance just to see. We have Victoria, we have Jordan, we have Christian, and Paige. So you can certainly look all of them up and just kind of get a little background feel for that. Be sure when you receive your text to text back the word SWAN, SWAN, so that we can reach out to you to get you scheduled for your consultation. I'm not rushing us off here. I just want to remind you of that again for our new people that just came on. And I'm so excited that you came on and that we are able to answer all these questions for you. And let me see if we have anything else here. I don't think I missed anybody, but I want to do another scroll through just to be sure. Let's see. I think we answered most of the questions. Make sure I got every single person in here. What tightens the skin along with fat reduction? Wonderful question. With CoolSculpting, often if I have a patient that has some elasticity loss on the arms, maybe the abdomen, I complete your CoolSculpting plan, and then you would see our laser technician for some microneedling with radio frequency, and we could certainly schedule a complimentary consultation with Stephanie. She is our, she's our laser technician here at the Swan Center. She's incredible, and she would be able to look at you and figure out how many treatments you would need and quote you for that separately. And when you do those in conjunction, it's really a beautiful result. What else do we have here? Can we request you for the treatment? I am the Master CoolSculpting Specialist here at the Swan Center, so I will be the one treating you. I would be honored to treat you, and be sure that what you're asking for is A, something that CoolSculpting can deliver for you, and B, keep you as comfortable as possible, give you the best results possible. And again, my favorite thing to tell my patients is your curves are my canvas. I have the opportunity to go in, give you the exact confidence that you're looking for with this technology. I want you to leave here at that 12-week follow-up knowing that you have made the best investment, feeling your most confident, and ready to just get out there and just live your best life. I just think CoolSculpting is such a personal choice because it really is about our confidence. It's for us. It's who we are. It's, a lot of us have, had children and we're like not feeling quite as good at some of the curves that we have, maybe a little too many curves. And CoolSculpting is such a nice way to go in and just kind of feel that little caveat to go in and kind of give us back a little bit more of what we're used to. For my patients that haven't had children, that maybe they just want to have a little umph in their step. They just want to have a little more confidence. Maybe you've got an event coming up. A lot of people will say, I'm getting married in 9 months, or I'm getting married in 6 months. What can I do? CoolSculpting is a great choice for something like that. And then we have our everyday, ladies and gentlemen, you just want to feel good. CoolSculpting is kind of fits for everyone. It's sort of a confidence booster. It gives you back what maybe you feel like you've been missing when you look in the mirror, and there's not a darn thing wrong with that. I know we live in a society that tells you have to be this or you have to be that. You just have to be you, and CoolSculpting can help you achieve that. Let's see, how soon can this happen from consultation to canvas? I'm ready to be art. Girl, that is what I'm talking about. We can certainly be sure to reply Swan, and we will give you a call tomorrow, and we will get you scheduled for your consultation. I would absolutely be honored to treat you and take a peek at you and see what we can do for you. I'm ready for your curves to be my canvas. So we just reply Swan so that we'll receive your information, and then we'll call you tomorrow to get you in for the consultation. Let's see here. Thank you. Great presentation. Thank you. I just think that I love what I do. And if I can pass that joy on to someone else and give them the confidence that they deserve, then that's what I'm here for. I think we all collectively feel that way at Swan, and we all work together to be sure that our patients are cared for and loved on and just really feel like they've made a great choice in practice and feel great about walking around and maybe sharing their thoughts of what they've done with other people. Or maybe not. Maybe it's just kept personal. All right. Well, we're about to wrap up. I want any other questions that you have, please send them. I don't want anyone left out. I want to be sure that I answer everything. If you have any last minute questions, go ahead and scoot them over here because I don't want to miss them. But if you get off of this event and you think, oh my gosh, why didn't I ask that? Text Swan. We'll call you and we'll get you in for that consultation. Let's see, do you guys have any specials for CoolSculpting? We certainly do. With this event, we are offering buy 4 applicators, get 4 free. So you're treating one area twice and getting another area treated twice for free. In addition to that, you're also getting a free area of Botox with the injector of your choice. And that is our special for this event. They generally are not free. So buy 4, get 4 free. We can figure out during your consultation how you would like to allocate those applicators on your areas of concern. That is exclusive pricing just for this event. It's really important that you reply Swan so that we can reach out to you and get you in so you can take advantage of this pricing. This is not our regular pricing. It will not be offered outside. It will not be offered outside of this event. So when you call or when you respond Swan, we're going to call you to offer you this exact pricing. Buy 4, get 4 free. If you would like the free area of Botox, we're certainly happy to offer that to you included. And then we'll get you in for your consultation. I'll look at those areas of concern that you have. We'll get that quote written up and get you on the schedule. I just want you to feel good. I would be honored to help you achieve that. Do we have any other questions? All right. Well, I think that I've answered all the questions. Again, if you think of any when we hang up, I want you to write them down. I want you to reply back Swan. We will reach out to you in the next day or two, get you in for your consultation. I literally cannot wait to meet you. And I'm so thankful and honored that you chose to spend your evening with me and with the Swan Center discussing all things CoolSculpting. I look forward to meeting each of you. I hope you have a wonderful night and let's keep in touch. I'll see you soon.